Hi everyone, welcome back to your channel High Low Pharmacology, and in this session let us discuss about the cardiac glycosides. So as the term indicates, these drugs are derived from one of the source which belongs to glycosides. So since it acts on the cardiac system, on the myocardium, they're called as cardiac glycosides. So the example here is you have digoxin. So please remember digoxin. So how you need to pronounce it? It is digoxin, digoxin, digoxin. So what is the source? It is a plant source. Basically, it's a plant source. It is derived from foxglove, foxglove, or it is also called as digitalis plant, digitalis plant, digitalis plant. So what is the basic mechanism? Basic mechanism here is all of these drugs will going to digoxin will going to increase the increase. Please remember cytosolic or cytoplasmic calcium levels or the concentration. Thereby what happens? It increases the cardiac cardiac contraction, so thereby it increases the cardiac output. So this is the basic mechanism of the digoxin, that is it increases cytosolic calcium concentration. So as you know that once the calcium levels in the any membrane muscle is increased, it will automatically leads to the contraction. So here in the cardiac muscle, it leads to cardiac muscle contraction, leading to the increase in the cardiac output. When it comes to the safety, please remember these drugs have got the low therapeutic index, low therapeutic index. So these drugs has to be maintained between the level of zero point 0.5 to 0.8, zero point 0.5 to 0.8 nanograms per ml, nanograms per ml. So since it has got a narrow therapeutic index, the drug must be carefully monitored for their plasma levels to avoid the adverse reactions. So what is the specific mechanism involved in increasing the or regulating the cytoplasmic calcium levels? So the specific mechanism in terms of first is how it will going to regulate the regulate calcium levels. So basically digoxin, digoxin, they bind to they bind to sodium potassium ATPase pump, which is present on the cardiac muscle, that is myocardium. So after binding to this, what it does is they inhibit the sodium potassium ATPase activity. So its activity is to cause sodium move out of the cell and potassium will be entering into the cell. So once you inhibit, what happens? There is a increased in the sodium concentration inside the myocardium, and simultaneously what happens is simultaneously it will going to retain, it will going to retain the calcium. So indirectly what you can say, indirect action is indirect action it blocks sodium calcium exchanger pump. Thereby what happens is calcium will be retained inside. So once calcium is retained, the cytoplasmic calcium concentration will increased, and this will going to cause the contraction contraction of the cardiac muscles. Thereby you can see this effect, that is increase in the cardiac output, increase in the force of contraction. So once it regulates the calcium, so since the calcium levels now they are increased, so what is the effect on the cardiac muscle? So the effect on the cardiac muscle is it will going to increase the force of contraction, and thereby it increases the cardiac output, and also it decreases the heart rate, and it decreases the oxygen demand. Apart from that, these drugs are also useful in the treatment of atrial fibrillation, as these drugs will going to decrease the conduction velocity by regulating the AV node. Apart from this, one more mechanism which you can expect is third. That is, it will going to decrease the sympathetic activity. It will going to decrease the sympathetic activity also, which are useful in the heart failure with reserved ejection fraction. So what are all the uses of the cardiac glycosides? So cardiac glycosides are useful in the treatment of the heart failure. So they can also be used in the treatment heart failure, reserved ejection fraction with reserved ejection fraction, and also they are useful in atrial fibrillation. So apart from this, when it comes to adverse effects of the digoxin, so since it is having a narrow therapeutic index, so you need to look for the toxicity when the concentration is increased. Like you should look for the yellow vision, anorexia, as well as you should also look for any blurring of vision, and also you need to check for the potassium levels. So decreased potassium levels will going to increase the digoxin toxicity, as you know that both potassium as well as the digoxin will compete for the same sodium potassium ATPase pump. So when the potassium levels are reduced, the digoxin will going to bind to the sodium potassium ATPase very quickly, and more digoxin will going to bind, leading to the toxicity. And also what happens means it will going to cause arrhythmias. So that's why hypokalemia should be avoided, and drugs which are causing hypokalemia should be avoided with digoxin should be avoided with digoxin. So this was a small brief review on the cardiac glycosides. So let us just revise it. So example is digoxin. So it is derived from the foxglove or the digitalis plant. The basic mechanism you should remember is since it is going to cause cardiac contraction, there should be increase in the cytosolic calcium levels. So this is responsible for cardiac output, thereby useful in the failing heart. So when it comes to safety, it has got low therapeutic index. You need to maintain the narrow therapeutic range. Otherwise, what will happen is the toxic effects. So what is the specific mechanism behind increase in the cytosolic calcium? So how this drug will going to regulate the calcium levels? So digoxin, by inhibiting the sodium potassium ATPase, it increases the sodium levels inside the cell. Thereby again it retains the calcium. How? It has got indirect action. It blocks the sodium calcium exchanger pump, thereby contributing to the increase in the calcium levels. So once the calcium is regulated, what happens to the cardiac muscles? So cardiac muscle will going to cause increase in the force of contraction due to the increase in the calcium levels, and thereby going to cause increase in the cardiac output. Simultaneously, one more advantage is it decreases the heart rate as well as oxygen demand, and also they are useful in the atrial fibrillation as it decreases the conduction velocity by regulating the AV node. So where are they used? So two conditions you should remember. One is the heart failure and in the atrial fibrillation. So adverse effects, you look for toxicity because of the narrow therapeutic index. The patient may have yellow vision, anorexia and blurring of vision, and potassium level should be monitored as the potassium and digoxin will compete for binding at the sodium potassium ATPase pump. So when potassium levels are decreased, more and more digoxin will bind to the sodium potassium ATPase, leading to the increased contraction, which can result in the arrhythmias. So this was all about the cardiac glycosides. So if you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.